everyone. This is probably the worst I've ever looked on YouTube. Hopefully the worst I will ever look. I'm not sure if you can hear me really well or not, but I wanted to start a new vlog for my road to my next baby. The last update I did, honestly I haven't looked at it, so I don't know if I updated about my pregnancy or my miscarriage. So my last pregnancy ended in a miscarriage, and I've had 3 consecutive miscarriages since that one. So my OB found it necessary to go in and do a laparoscopic hysteroscopy. I don't know, I can't say it right, I'm sorry. Where they look at the inside of your uterus going in through your vagina. And while she was in there, she removed some polycystic ovarian cysts on my ovaries. She burned off some endometriosis, and it ended up that I had a massive amount of scarring on the inside of my uterus. They were seeing things on the ultrasound and had done checks for cancer, which had preliminarily came back as positive, but you can't say for sure until you biopsy and check it. And a bunch of stuff's been going on. My ANA came back positive finally, so they know I have some kind of autoimmune, but we haven't tested fully for what. But that shouldn't have been an issue, seeing that I'm on blood thinners anyway. I'm really hoarse because, of course, I got intubated. I had surgery this morning at 7. It is now 5:15. Can't see the clock. I'm 5:15. I'm still really tired. Still just thankfully I do not hurt that bad at all. I'm sore, but it's not like, oh my god, or anything like that. I guess maybe where I've had a C-section 8 months ago, and I know the pain of that. This is cakewalk. I did much better on this surgery than I did my last. You could watch that video from 2011. I think it was in November too. I think it was in November. This one's, yeah. Because this is December. Yeah, the last one was in November 2011, so you can watch that. I flip out. So I'm waiting on her to bring my medicine. If I kind of stop in the middle of talking and talk to the nurse, I'm sorry, but I don't want to have to redo all of this. Talking really hurts. So long story short, I'm here overnight. They want to hold me to watch me because my blood pressure dropped during surgery, after surgery, and they checked it a little while ago, and it's still pretty low, which is why I'm really tired. But it's not like so dangerous that they want to give me a medicine or anything for it just yet. They're just coming in to check it every hour. And they say I can eat dinner, so I'm hoping that'll be here soon because I'm really hungry. The nurses are really nice, though. They brought me chicken broth and some hot chocolate earlier, which felt amazing on my throat. I didn't drink much of the hot chocolate, though, because chocolate has caffeine, and I'm not a big fan of caffeine or sugar, so I drank the chicken broth, and it was amazing. So they brought me this little handy-dandy tool. You are supposed to suck in, so you breathe out, you suck in on the tube, and it's supposed to help prevent any kind of lung infection from being in the hospital after surgery. So you try to keep it between these 2 indicators, and you can use your own little self score beater lever here. It moves up and down. The best I've done is that, so I try to beat that whenever I do it. I try my best to do 5 breaths every 5 to 10 minutes to make sure I keep that good and clear. I have a few pictures. So before I show these, that way you can stop it if you don't want to see the pictures. This will be the start of my trying to conceive again vlog. This is day 1. My cycle was actually 9 DPO, so I should start in 3 or 4 days. I haven't bled a spot at all since I had the surgeries, which is amazing to me. But I'm guessing it'll kick up probably tomorrow a little bit. So that's it for right now. Thanks for everyone that follows me and sends me messages. Though you may not comment on the video, I do get your private messages. And anybody who gets grossed out by stuff and doesn't want to see my insides, you can exit now. Okay. All right. So this is my right fallopian tube entranceway and inside the right fallopian tube. So that's the entranceway, and that's inside. And she cleared all that out. It wasn't blocked, but she said it had some not fibroids, but just some fibrous tissue, and she cleared that out. And then that was my right. This is my left opening. She got rid of that, which can cause an ectopic. And she said it was actually lucky we caught it, because the egg will implant there, because the blue you see is the dye they injected into me, and the blue shows blood flow, so the baby very well could have attached to that and grown to a size that it would have been dangerous. Okay, this is two of my ovaries, one of each of my ovaries, the exterior of my uterus, the top and the front. So I don't know which ovary is what. But the little spots is where she popped the polycystic ovarian cysts. So those are my ovaries. And then this is actually the front of my uterus. This is my bladder. And then this is the top of my uterus. And then this is the endometriosis that she burnt off, which I've never had before. This is my second laparoscopic surgery, and I've never had endo, so it was something very interesting and, you know, kind of bothersome to hear. And then here is the big culprit. This is the scar tissue that had built up inside of my uterus that they thought was the cancer, but once they removed it and biopsied part of it here in the hospital, it took like 12 hours. The preliminaries came back as absolutely not. It was just benign scar tissue. So this is probably what's been causing me all of my miscarriages. She removed completely all of that and then removed this right here as well. And honestly, I have no clue what that is. I don't know. I know that's fat, which is gross. I'm so fat now. I don't know what that is. But yeah, that's where we're at. Thanks for watching. I'm gonna go. My throat's killing me. I'll try to tomorrow to tell you how I'm feeling 2 days post-surgery. And thanks again.